Hello everyone, my name is Nicole Pino and I will be presenting on preterm births. According to the CDC, preterm birth is defined as a baby who was born before 37 weeks of pregnancy. There are three subcategories of preterm birth, and these are based on gestational age. First, we have extremely preterm births, which are those that are born before 28 weeks of pregnancy. Second, we have very preterm births, which are those that are born between 28 to 32 weeks. And third, we have moderate to late preterm births, which are those born between 32 to 37 weeks. Babies born too early, especially those born before 32 weeks, have higher rates of death and disability. A baby born preterm poses greater health risks such as breathing problems, feeding difficulties, cerebral palsy, developmental delay, vision, and hearing problems. In fact, a recent cohort study published in Maternal and Child Health Journal was able to examine the association between extreme preterm births and full-term births and each of their abilities in fine motor skills, reading, math, by the time they reach the age of 5. Based on the study, they found that extremely preterm births were 3 times more likely to fail in drawing basic shapes like squares, circles, and triangles. Most importantly, this cohort study reiterated the importance of early intervention programs for babies born prematurely. Determining the cause for preterm birth is a complex health problem. However, there are many contributing factors that increase the risk for preterm births, which include sociodemographics, medical, and behavioral characteristics. Sociodemographic characteristics that are associated with preterm births are race, ethnicity, age, income, education, marital status. Medical conditions that influence the risk of preterm birth include infection, preeclampsia, diabetes, multiple gestations, and/or previous preterm births. Behavioral factors include maternal use of tobacco, alcohol, and/or drugs, as these all increases the likelihood of giving birth to a. I would like to emphasize maternal stress based on a recent case control study, as they found a significant statistic evidence regarding maternal stress exposure. Based on the findings from the study, they found that maternal stress during pregnancy had 2 times the odds of giving birth to a baby preterm. In 2016, 9.8% of infants are born prematurely in the United States, while 17% of infant mortality is related to premature birth, making this the second leading cause of infant mortality. In 2016, 9.9% of infants are born prematurely in New Mexico. It's just a slight higher than the national rate. 20% is the infant mortality related to preterm births in New Mexico, also making this the second leading cause of infant mortality. In 2016, 10.7% of infants are born prematurely in Bernalillo County, which is higher than the national rate. The infant mortality is 6.3 infants' deaths related to preterm birth per 1,000 live births. The preventative measures for preterm births consist of a healthy pregnancy, which will include quitting smoking, avoiding drugs and alcohol, and getting prenatal care very early on. And most importantly, talking to your doctor if you've had a history of preterm births. The Maternal and Child Health Epidemiology Program provides direct assistance to public health agencies. The CDC's funding supports to improve healthy births and reduce preterm births through research, and their partnership with March of Dimes helps to see measurable improvements in preterm health outcomes. The science around this health issue has created some significant changes in community healthcare interventions by seeing the importance of utilizing early interventionist programs for children who are born premature. This program conveniently offers linguistics, occupational and physical therapy, and audiology and optometry help. And with advocacy efforts, programs like Native American Professional Parent Resources provides the necessary resources for tribal communities surrounding Albuquerque area that are affected by preterm births, which in New Mexico is at a 8.5% rate.